Hi everyone, this is the first week of April and I recently got my braces off 3 weeks ago, and so this is going to be one of my last videos, if not my last, if nobody requests me to do anymore. Um, for those just tuning in, I had jaw surgery to correct my overbite almost 9 months ago on July the 14th of 2014, and overall the journey took about just over a year and a half. But it was very, very well worth it. Um, I guess I can show you my smile, my teeth. Other side. My teeth are surprisingly very white. I have no clue why they are so white. I did not whiten them yet. So I have no tips to offer you as to how to keep your teeth clean during braces, because I just brushed my teeth like normal. I didn't even use any whitening gel or mouthwash. Um, I get a lot of private messages asking me if this was worth it. Jaw surgery is so worth it. I am so much more happy. I'm so much more confident in myself. Um, so if you're contemplating it, do it. If it's always on your mind, do it. Do it for yourself, and don't do it for someone else. Um, Somebody asked if I get a lot more attention, and I do. But again, don't do it so you would get more attention from people. Do it because it makes you happy, and do it because you need to. Don't do it for anyone else. You're going under the knife. Someone also mentioned in my last video that my nose looks different. The reason why my nose looks different in the last video was because I decided to get a nose job, and I was a recent post-op in that video. I think I was just 3 weeks post-op or something. So I was very swollen. I just wanted to mention that because I don't want anyone to think that by getting your overbite corrected that your nose would change, because your nose should not change. Unless you are operating on the upper jaw, then your nose would change. And usually only underbite patients get their upper jaw operated on as well, if even. I'm not going to really get into my nose job because that's not really what this video is about. If you want me to, you can leave it in the comments down below, and I can make another separate video for those who actually care for that. I will have to say, this jaw surgery process sort of makes you become more critical and analytical about the way that you look, and very self-conscious, or maybe that's just me. But I'm very happy with the results, but I'm not completely satisfied with my jaw asymmetry, which has nothing to do with my surgeon. Correcting the asymmetry in my case would be beyond the scope of what my surgeon does for a living. The asymmetry comes from my jaw angles, which my surgeon does not have access to. He only has access to this part. As you can see, the side of my face is not only is it larger, but this side is shorter and this side is longer. My options are I can get implants to correct the asymmetry. I can cut off this side of my face and just deal with the fact that this side is bigger, which I'm okay with. I just really don't like how it's slanted. So I can get implants, I can shave this off, or I can get fillers and fill in the hollows and fill in the side so it's bigger, or I can get fat grafting. I think I've decided on temporary fillers in a month. I'm going to get fillers in a month, and that usually lasts for a year, and then from then I'll just see how I like it, if I want to continue with it or if I want to shave it. I don't think I'll get implants just because that's very risky. For those who are curious, I guess I can do another video on fillers, if you want. For those who have watched my other videos, I mentioned that I have TMJ, and I I've had it since I was 14 years old, so about 7 years now. On this side of my face, and after my surgery, the TMJ pain went away, and then it came back when I was 4 months post-op. And so my dentist said I could get Botox injections, which is what I did on this side of my face. And she warned me that if clenching is the reason why I have TMJ pain, then it's likely that once I relieve this side of pain, then this side will start clenching and I will start experiencing pain. And that's what happened. So now I have to get Botox on either side of my face. I think every 8 weeks, and then the more I do it, the less I have to do it over time. So I get about 50 units of Botox injected total in both sides of my jaw, and it's $10 a unit. It's very pricey. So if you're experiencing TMJ and you want to do Botox, I suggest you looking to see if your insurance covers it. I don't really have anything else to talk about. If I could leave before and after photos that my dentist took. If you have any more questions or concerns, you can write me in the comments down below, or if you want me to request a video, or if there's enough questions, I could just do a Q&A video. But other than that, this should be my last video, so thanks for watching.